Hello and welcome everyone. I'm Dr. Tom Chaney and this is Living Health Live. I'm excited to be joining you as well as I cut all that out.
45.
Hello and welcome everyone. I'm Dr. Tom Chaney and this is Living Health Live. Joining me on the show as well as in life and in our practice, Living Health Integrated Medicine, is my wife, Dr. Stephanie Chaney, here with us today. We are your trusted source for the latest information to get you healthy, have you stay healthy, all naturally. So we're super excited for today's show. Today, we're going to be talking about what the difference is between type 1 and type 2 diabetes. So you have to know the difference. Many patients come to us and they're not sure, are they type 2 or type 1? They've just been told that they're diabetic. So let's jump in. So let's start with type 1 diabetes. So Dr. Steph, what is type 1 diabetes?
So type 1 diabetes has historically been known as juvenile diabetes because it was mostly found in young people. And it is a very common pediatric type of diabetes. So most kids that have diabetes, all the way from toddlers up to teenagers, it usually more often than not is type 1. And but we are finding, people that are becoming type 1 later in life as well. So type 1 is an insulin-dependent diabetes. And this is caused by the destruction and the loss of function of the insulin-producing cells of the pancreas. So essentially something assaults the pancreas and causes it to basically not be able to produce insulin anymore. And so now the person actually has to take insulin externally in order to manage blood sugars. And that is regardless of what the patient is eating. So this isn't necessarily a diet dependent type of disease. I mean, it can definitely be affected by diet, of course, but from a cause perspective. So usually what causes this is some type of viral infection or other type of infection that can actually destroy the pancreas, or an autoimmune attack. And that's where your immune system can actually start to attack the tissue itself. And this is very common in type 1 diabetes, especially later in life. And that autoimmune attack can actually be triggered by many things: environmental toxins, chemicals, including vaccines. And so people don't realize that vaccines can actually, that is a known cause, and that's documented, of both childhood type 1 diabetes as well as autoimmune diabetes later in life. And that's partly because of the viral components. So much like a virus can cause your immune system to go on the assault and destroy the pancreas, the virus particles or live virus vaccines can actually induce the same type of thing. And of course, there's many, many chemicals, heavy metals, toxins, environmental toxins, especially things like herbicides and pesticides can also contribute to autoimmune type 1 diabetes. More often than not, this type of patient may present as a thin diabetic. So whether you're an adult or whether you're a kid or a teenager, and oftentimes this is a person who might not even get diagnosed until there's such a crisis. Usually what happens is the pancreas is destroyed slowly over time, and a person doesn't even know that they have this until, pretty much they get to a point where they have no pancreas function left, and the sugars are extremely high, and there's some type of major health crisis that ends them up in the hospital. But they may be thin or losing weight dramatically all the way up until that point. So that's the typical general presentation of a type 1 diabetic. But really, the takeaway from this is this person actually has to be taking insulin in order to survive. And it doesn't matter what they're eating. And
you mentioned a couple terms. So we'll go back and just talk a minute. And you mentioned the pancreas and insulin. And so maybe just talk about real quick. So insulin is a hormone produced by the pancreas. So what does insulin do?
Well, insulin is the hormone that actually regulates blood sugar. Specifically, what it does is it connects with blood glucose that's circulating around in the blood, and it actually helps it get into the cells. So without insulin, sugar would not actually even come out of the blood and into the cells. And so it is required for sugar uptake. And therefore it's required for, energy production in the cell. Insulin is also a hormone that actually works with fat storage, not just sugar storage, and proteins and different types of mineral and electrolyte regulation as well. But the main thing that most people associate insulin with is sugar management. So we don't want sugars to be elevated beyond, really ideally between 85 and 100 in terms of a blood measurement of sugar. And if blood sugar is excessively high, when sugar goes high, it stimulates the pancreas to secrete insulin so that insulin can circulate to get sugar out of the blood and put it into the cells. And so that's in relation to diabetes, that's what insulin does.
Okay, great. So let's talk about type 2 diabetes now. This is the type of diabetes that most people are more familiar with. And when they hear about insulin and insulin resistance, it's typically correlated and talked about with type 2 diabetes. So let's talk about and define type 2 diabetes.
So type 2 diabetes is actually insulin resistant diabetes. So this is where the person is producing insulin, but their sugars are extremely elevated, and insulin sensitivity has gone down, or the insulin receptors on the cells aren't functioning as well, or the body's just not able to produce enough insulin to handle an excessively high amount of blood sugar. And generally, type 2 diabetes used to be known as adult onset diabetes, because we see this more diagnosed in the older population. But because this is a lifestyle related disease, diet, activity, exercise levels, things like that, we are actually seeing it more and more in children. It's not uncommon now to find an 8-year-old or a 10-year-old to be diagnosed with type 2 diabetes. So the pancreas does make insulin. That's the main difference between type 2 and type 1. But you just can't make enough to handle the enormous amount of blood sugar. So lack of activity or exercise can cause sugars to become high because the muscles aren't going to be burning sugar as effectively or needing sugar. Or diet. If a person is eating excessive amounts of carbohydrates or sugars in the diet, then it's just more than what the body was ever designed to handle, and the pancreas just cannot physically make, even a healthy pancreas can't make necessarily enough insulin to override that blood sugar. And insulin and blood sugar can, over time, if you're over hammering the cell's insulin receptors, then the receptors, which are like the keyhole that insulin fits into to help sugar get across the cell membrane, insulin receptors can become damaged, or the body can just not be able to keep up with making enough insulin receptors, or the cell literally has enough sugar and just shuts and activates the receptor to try to keep sugar out, because sugar in excess can be damaging to all cells and tissues. So diet, lifestyle is more to blame for this. Hormone imbalances can aggravate or lead to or contribute to type 2 diabetes. Excessive stress, of course, we're dealing with lots of things going on right now in the world that can cause increased stress. Lack of sleep or sleep deprivation. So we do know that working night shifts or having insomnia is a contributing factor, mainly because of the effect on the hormones. Infections can actually cause sugars to be elevated, because anything that causes inflammation can cause sugars to go high. And then nutrient deficiencies. So if you're deficient in certain nutrients, then you will not be able to maintain healthy insulin receptors, healthy cell membranes, things like that. The difference between a type 1 and type 2, where a type 1 may more often present as a thin, skinny person, with blood sugar issues, the type 2 diabetic more often presents as overweight with metabolic syndrome, so hypertension, high blood pressure, elevated cholesterol, and generally speaking, these are going to be more obese people. And in the case of type 1, if the pancreas is destroyed, there's not really any reversing of that. It's just really teaching a person how to properly manage it to avoid complications. But type 2, in most cases, and that is documented statistically, most cases of type 2 are not only preventable, but actually reversible.
So as opposed to type 1, where the pancreas is not producing insulin, type 2 diabetics, they're producing excess amounts of insulin and they have excess amounts of glucose in the bloodstream. And so then that causes a whole downstream effect in many different dysfunctions in the body, which then leads to what you just talked about.
Yeah, eating a very high carbohydrate, very high sugar diet with very low activity for years and years and years causes sugars to be high. And the blood sugar may actually look somewhat normal in a person in the years leading up to a diagnosis, like pre-diabetes on up to diabetes, because the body's producing more and more and more insulin. And oftentimes most doctors are not measuring insulin markers to determine that. So sugars could look normal for a while, but the person's really having to pump out super high amounts of insulin. And insulin is very destructive to the system. And insulin, not just sugars, is what causes a lot of the complications of diabetes, the damage to the blood cells, the brain, things like the nerves, things like that. So it can be hidden and it can be silent for a long time until eventually the pancreas just is not able to produce enough insulin to keep up with this really, really high sugar load. The system starts to lose insulin sensitivity and shut down receptors. And so the body doesn't respond to that amount of insulin anymore. And that leads to, over time, the sugars getting higher and higher and higher. And eventually a diagnosis is usually made.
Right. Okay, let's go to this one. This is a type that is not talked about that much, and most people don't know about this type. It's type 1.5, also called LADA. So what is that all about?
Okay, so when we talked about type 1 diabetes, that's an autoimmune situation or virally induced pancreas destruction. So this is an insulin-dependent situation. Later in life, even though that's more commonly associated in childhood, I did say that adults can actually get this later in life. And what we are finding, and we are finding this more and more because of how toxic our system is and our food supply, and with more and more and more vaccines on the market, which is a source of viral particles and toxins and heavy metals, we're finding more and more people have a combination of two things. So sometimes it's referred to as type 1.5 because a person can start off as an adult with type 2 diabetes, right? Just from bad lifestyle, preventable things. And then something happens to them, a trauma, a toxic overload, a vaccine, a viral infection, a terrible, terrible flu situation. And then now they start to actually have an attack on the pancreas. And over time, they become more and more type 1. So they're both type 2 and type 1. So they call it 1.5 because it's kind of like in betweeny. But also formally, it's known as LADA, L-A-D-A, which is latent adult diabetes autoimmune. So this is a later in life kind of type 1 autoimmune type of diabetes. And the person may or may not also have been type 2 prior to this diagnosis. And so there can be insulin resistance with this, plus the type 1 attack on the pancreas. Over time, this person is going to be, if it's not found and diagnosed and handled correctly, this person is very likely to end up being insulin dependent later in life with no pancreas function, and may also have this other underlying type 2. And this kind of creates a really health nightmare for this person with lots of different complications if it's not, again, diagnosed and handled properly. And so this person could present as either overweight because they were type 2 before this happened, or they've been kind of thin their whole life and then this happens and they stay thin or get thinner. So it's kind of a mixed bag with this one. But it's not uncommon for us to find people that come to see us for type 2 diabetes reversal. And then we actually work them up and find out that, oh, you're actually autoimmune. You're type 1.5, or you actually have LADA. And that means this person has an autoimmune disease that we have to work on. It's not just lifestyle. There's other factors that we have to consider. And it's interesting because autoimmune patients like type 1 or 1.5 LADA patients often have other autoimmune diseases underlying this as well, or concurrently, like rheumatoid arthritis, celiac disease, thyroid, Hashimoto's autoimmunity, things like that. So there may be a lot of different things going on. This person might be on a lot of different medications, but they think very often they're diagnosed medically as type 2 and they're managed that way throughout life. And they have no idea very often that they have this autoimmune thing happening underneath the hood. And so that can eventually lead to complete destruction of the pancreas and an absolute necessity for a lifelong dependence on insulin medication.
Yeah, we're seeing most of the patients that come in that are 1.5, they don't know it. We're actually making the diagnosis. And I'd say it's about 10 to 15% of the people that come in that are type 2 diabetic, they actually are 1.5.
Yeah, and in the history, sometimes what'll happen is this person comes in, they're maybe in their 60s, their 50s, they've been diagnosed as type 2 diabetes just because they were an adult when they got diagnosed. They may or may not have some weight issues, but some people come in and they've already put themselves on a strict diet. And their sugars are just all over the place. And so when a type 2 is really having a hard time, even if they do something extreme like a fast or whatever, if they're still having really crazy high sugars, you do have to start thinking, does this person actually have an underlying autoimmune condition? And are they losing pancreas function? And do they actually need some insulin? In some unfortunate cases, we've had type 2 diabetics come to see us and their sugars were just so out of control. And it actually turns out that they had such little pancreas function, they actually needed to be put on a small amount of insulin to properly manage. While we were actually reversing the type 2 diabetes, we had to get them to properly manage the lack of pancreas function in order to get the best health outcomes. It can be a pretty weird, complicated situation.
So take-home message is the earlier you know this, the earlier you get on this, the better outcomes and the better results we can get with you.
Yeah, and I just don't think we can assume anymore that a person of any age is one or the other without really working them up comprehensively to rule everything out. Otherwise, you could just be wasting time and giving incorrect advice, even with lifestyle
Absolutely.
recommendations.
All right, good. So let's talk about some of the tests that you need to be asking your doctor about, making sure that you're tracking, staying on top of these numbers. You have to know your numbers. So let's go through some of the key markers and indicators. Some of these are probably going to be familiar to some of you, and then some of them are probably not going to be familiar.
Right. So these are good things to minimally be looking at, and most doctors will be running at least blood glucose. They should be running hemoglobin A1C. Even fasting insulin is a marker that could be run. But if you're really trying to be comprehensive and make sure you don't have an autoimmune situation or a pancreas problem, insufficiency problem, then some of the other markers to run in addition to hemoglobin A1C would be, for example, C-peptide, some immune antibody markers, and then some other things like triglycerides. This just helps us rule out if a person is one or the other or a bit of both. So blood glucose is just a measurement of the amount of sugar that's in the blood. So serum is blood by definition. Hemoglobin A1C, so the hemoglobin is part of the red blood cell. And it's very easy, it's very susceptible to what's called oxidative damage. So free radical formation, and sugar is one of the main culprits. It's one of the most common causes for damaging these red blood cell hemoglobins. And so technically that marker, hemoglobin A1C, is a percentage of red blood cells that are damaged by oxidative stress, which more often than not is because of blood sugar. So if sugar gets really high, you start to damage red blood cells, and damaged red blood cells we can measure through this hemoglobin A1C marker. So the more inflammation someone has for any reason, but mainly what we see is most commonly it's blood sugar, that can lead to that marker going up. The normal range is roughly 4.678 to 5.7%. Basically what we say is 5.7% or below. Pre-diabetic range is over 5.7% all the way up to 6.4%. And if you get over 6.4%, you will be diagnosed with diabetes. Hemoglobin A1C can be high in both type 1 and type 2 diabetics. And that's a marker that has to be looked at in both cases. Same with blood sugar. C-peptide is a protein that is attached to insulin. It's kind of like when a hormone gets secreted by a gland anywhere in the body. Usually it's kind of wearing a hat. So that it's not activated until it can get through the body and in circulation. Otherwise, it would just act right outside that gland. And so we don't want it to be activated right away. And C-peptide, basically, it's in a 1-to-1 ratio of how much insulin has been released by the pancreas. Because it's not the one that's being used, insulin's the one being used. It's a more stable marker than fasting insulin for us to determine, oh, is the pancreas secreting insulin? Because C-peptide will be in a normal range, range as far as that goes. If C-peptide is extremely low, if it's below 1, and in particular, if it's in the decimals like 0.5 or 0.4. then we're really looking at a pancreas that is not sufficiently producing insulin. And if we're over a certain range, we've got really high C-peptide, then we're looking at a pancreas that is more of a type 2 situation. This person's really, really pumping out excessive amounts of insulin, more than what is normal for a fasting range, because there's just so much sugar going on. And so really high C-peptide is usually an indication of insulin resistance in type 2 diabetes, whereas very, very, very low is usually related to a lack of pancreas function and a possibility of autoimmune or type 1, 1.5. This is also what we look at with the adults. The antibodies tell us about immune activity against a tissue. So for example, we will look at different antibodies for thyroid if someone's immune system might be attacking thyroid tissue. We would look at different antibodies for insulin or pancreas cell or pancreas enzymes, depending on what type of disease. If we're looking for type 1 diabetes that is autoimmune related or related to your immune system attacking, then there will be immune antibody proof of that, basically, that your system's wrongly attacking. And then we can actually create a diagnosis of autoimmune pancreas issues, so type 1 or type 1.5. Triglycerides, when people get a cholesterol panel, most type 2 diabetics or people with elevated sugars will also have elevated cholesterol levels or lipid levels, fatty levels in the blood. Triglycerides is a sign that your body is so resistant to getting insulin, sugar, particularly into muscles, that the body now has to try to make it into more of a fat so that it can actually be stored in fat cells. And that is what triglycerides are. So elevated triglycerides, like really, really high triglycerides, are another indicator for us of insulin resistance and type 2 diabetes usually. So these are just some of the big markers that we use for trying to differentiate and manage and track progress of different types of diabetes.
Great. Okay. So the serum blood glucose, that's the one that you guys are checking on your meter at home. So that's 85 to 100. That's your fasting. That's normal. And then A1C, as Dr. Steph said, below 5.7% on no medications. That's a non-diabetic range. That's what we're looking for there. All right. So let's talk about solutions. You need to know what you have, and once you know what you have, you need to know what are the causes and then how do we handle that. So let's talk about that.
Well, for example, we need to know what type of diabetic a person really is in order to develop the right protocols for a person. So if somebody comes in, for example, and they're actually, it turns out they're eating a very good, healthy diet and they shouldn't have really elevated sugars, or if a person comes in and they're type 2 diagnosis, but they're on really, really high amounts of insulin, we need to rule out if that person's actually a type 1 diabetes, because we would be approaching that person as though they're an autoimmune case, or there's some type of underlying inflammatory trigger or cause or aggravator to keeping the immune system constantly attacking the pancreas, which is very different approach to whether a person's type 2 diabetic. And so we just need to know like what a person actually is walking around with. And then we need to figure out what the underlying cause is of that person's condition. So are they type 2, type 1, or 1.5? And if they are one of those things, then we need to kind of determine what might be aggravating or contributing to them staying in that condition, especially if they're type 2, which is reversible and preventable. So we need to kind of look at these different things. So each one is treated a little bit differently, and in some cases a lot differently, depending on what they are. And I think the important takeaway today is understanding that type 2 diabetes actually can be reversed. And so it's really important to know that you are a type 2 diabetic versus a type 1. And that's mainly to be able to set realistic expectations. If you come in and you're type 1 or 1.5, and you have a completely destroyed pancreas, it's not going to be realistic to reverse that. What you're going to be doing is we're going to be teaching you how to manage it so that you can maintain your sugars in a healthy level and insulin necessity in a healthy level, because the outcomes are a little bit different for each of them. The main thing with a type 1 is we want to teach a person how to manage to prevent the complications. And with a type 2, we want to reverse to prevent the complications. And many times we're able to actually reverse people's condition to the point where they're able to reduce and completely eliminate their medications, and they're no longer diabetic anymore. That is ultimately what our goal is when we're working with a type 2 diabetes. So it's very important to know the difference between them so that we set realistic expectations for the patient.
All right, guys. So you got to know your numbers, got to figure out what type you are, and then you got to get a path to know, okay, how am I going to optimize my health? So yeah. I hope you got some great information out of today's show. I'm Dr. Tom Chaney along with Dr. Stephanie Chaney. If you want more information, check out our webinar. So we have a diabetes solutions webinar. We'll put the link to the webinar down below where you can get more information like you got from today's video. And you guys have a great day, and we'll see you soon.